what people have to understand is that once you've survived cancer, it's not necessarily totally gone. Those cancer cells may live dormant in different parts of the body, so you want to be vigilant in optimizing your health. So you may have had the surgery, you may have had the radiation, chemo, you may be in remission, whatever the case is, but that's time for now to optimize your health.
We have a patient named J.M. She's 57, has a history of left-sided breast cancer that was treated in 2021 with a lumpectomy, removal of a lymph node, chemotherapy, and radiation. And then just recently this January, she had gone to the emergency room for neck pain, and they found a lymph node in the neck. So that was new, and she came here wanting to really get her health in line and figure out what she should do nutritionally to support her own immune system. So we did get started into some of the discussion of the things we would recommend. One of the big things is the micronutrient test to see what her personal intracellular deficiencies are and which antioxidants will actually work the best and help her body heal. Because we know a lot of the big anti-cancer agents, broccoli sprouts, vitamin C, curcumin, and this would allow us to be even more specific for her. She was really interested in the ozone therapy as well, which helps modulate our immune system to fight off disease and heal the body, so shift to more cell repair rather than negative cell changes or cell death. And do the detoxing, of course. She had already started trying to eat healthier, but, we needed to fine-tune that.
Wow. So very interesting clinical presentation. So here's one patient who had, I guess you would call her a breast cancer survivor. So she had the surgery. I do remember she has lymphedema on the left arm.
Yes.
And she told me after they started an IV in an emergency room, immediately after that, she had lymphedema. Now, she does not recall being told not to have a needle stick. So for those of you out there who've had breast cancer, surgery on the side, no needle sticks or blood pressure measurements on the same side of your cancer surgery. Normally they are told that, and she wasn't informed that. So that's something we're going to look into with some vascular studies and the like. The interesting aspect of her story is that she's a breast cancer survivor, but now there's some small little things coming with the thyroid, nutrition, and various other approaches that you mentioned, such as anti-inflammatory, immune boosting, supplements. We're being pretty aggressive with her, given the issue with the arm. We're going to add some serapeptase to the regimen to decrease inflammation, and not natural kinase. She can have microscopic blood clots. We'll do an ultrasound, make sure it's not a vascular bruise of that arm. Yeah. So these are the things that we're going to work with her on. But the key part here is you have a breast cancer survivor, but you have to be vigilant with going on. Now, she had a number of other issues. She lost her son tragically earlier that year, so there was some emotional stress, which can also have an adverse effect on the immune system. And so she was going through that. She also had mold in her house. And so that's why she had to go to the emergency room, get an IV. That's why they stuck her. That's stressful. So, oftentimes life gets in the way, and we have to be mindful of these things. And so we work with our patients, being mindful of these issues that are going on. We address it on a clinical standpoint. We give them recommendations on how to cope. She's coping with her son's death reasonably well by her account. The issue with the mold is being addressed. Her mood is up, and so she's ready to move to the next level. So these are all the things that you want to be mindful of. And even though you can't control life events, be mindful of the potential impact they can have on your life and your health, and try to address it. So, for example, if you have a busy work schedule, you have a stressful issue with a loved one, you can optimize your diet as best you can and make up for it in some other areas until you're able to get over these areas. So I think this is very, very important, but I look forward to seeing her outcome as we move forward. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.